how you see yourself is your identity. But I'm a feminine, non-cis person. I do get dysphoria with certain aspects of my life. Like, I still have a she-ness. It's Brandy's world, and I'm Brandy Moho. Welcome. Yeah, I'm a transgender person. I prefer the term non-cis because I think transgender talks to a method of getting to womanhood or a method of getting to manhood. Whatever you're transitioning your expression to, it's a verb. So transgender to me is not a noun, it's a verb. It doesn't identify me. I'm a non-cis person. And if those of you just tuning in to me and you're going, what the hell is non-cis? And the way I like to explain non-cis from cis would obviously be, the opposite of. And everyone who's born in Western culture, here in the United States especially, when you're born, you're assigned an identity, a gender, and it's based off a doctor looks at you and goes, ooh, look, I see a dangly thing, or ooh, look, those sex organs are not dangly thing, there's a vagina, or there's a penis, and therefore we're going to assign a gender to that baby with the sex. And for most people, yeah, that's going to be what their gender identity is, and that's what they're called cis. So basically, if you agree with the assignment you got on your birth certificate, you're cis, congratulations. If you do not agree with that assignment on your birth certificate, then guess what? You're non-cis. I'm non-cis. And what you do with that information is up to you. And some people identify as transgender. And for me, I don't really see transgender as an identity. As transgender, I'm transitioning my gender expression to more closely align my gender identity. And that's what the transition part is. It's simply getting your identity, which is within you, how you identify yourself, how you feel about yourself, how you see yourself, and how you express that is your gender expression. So, my identity, I see myself feminine. My expression, I attempt to express myself feminine as I can because I'm trying to align those two things. And that's where dysphoria comes from, is the misalignment of your gender expression with your gender identity. And for me, I've been fortunate enough, if you've seen a few of my talks, I talk about some of the surgeries that I've had, medical treatments that I've had to treat my dysphoria, to more closely align my gender expression with my gender identity. And those surgeries have been wonderful. I talk about my facial feminization. Work so well for my dysphoria. It just starts rubbing away dysphoria when I'm able to look in the mirror, look in the societal mirror and see myself more closely aligned to my identity. Not there. I don't think I ever will get there. I don't think you ever are going to be, oh, this is exactly how I see myself. No, you're always looking to make yourself a better you. And I will always attempt to make myself a better me. So in a sense, I'm always transitioning. So, but I'm a feminine, non-cis person. I think that's the identity that best identifies me. And a lot of my treatments have taken away my dysphoria. I don't have that dysphoria when I look in the mirror so much. It's great. I do get dysphoria with certain aspects of my life, like I still have a she-ness. And I feel a lot of dysphoria having sex organs that don't align with my identity as I see myself. And I thought when my transition, like many people who are transitioning their expression in a dramatic way, I'm shifting my expression from a very masculine presenting way to aligning my identity very femininely. And the closer I get to how I see myself aligned, I see my dysphoria going away. And I thought, I can be out and have my dysphoria kind of gone and not worry about it, but a big part of my life is my sex life too. We're sexual beings, we're a highly social species who have libidos that drive us towards each other. So I started getting very frustrated with the sexual organs I have. But also getting bottom surgery, what actually I'm getting is a vaginoplasty and a vulvoplasty. So the doctor I'm going to go to, okay, so that's my announcement thing. I'm having my bottom surgery. I've had my facial feminization surgery. I've had my breast augmentation surgery. I've had laser hair removal. I've had an orchiectomy as well, but I thought I held off on having my bottom surgery for a while because most gender women don't have bottom surgery, and it's kind of a cultural thing. Like if you travel lots of places in Southeast Asia where the culture is a little bit different, looking towards non-cis people, and more people in those areas have bottom surgery here. Right? So it's kind of a cultural thing. It's kind of medical access. Like there's not a lot of doctors who do that surgery. You have to scour across the entire country to find a doctor that's going to be able to do the surgery that you feel comfortable with that doctor doing it. And I literally searched a few times for doctors, trying to think, I'm going to have the surgery, I'm going to go through with it, like a couple of years ago, and it was just, the more I looked into it, the surgery's fucking scary. It's a scary ass surgery. I try to watch it on YouTube of actual surgery happening. I still have not been able to make it through a whole video showing a vaginoplasty surgery. It's scary, but so I tell myself, I know what the results are going to be, and the results are what I want. The process is going to suck. It's going to really, really suck. But I have to go through tough processes to treat dysphoria, basically. And I deserve to have the sex life I desire now. And I just don't fully have that with the sex organs I have right now. It just doesn't work for me. For me, it does not work. And I've come to a point in my life where it's more than I want to have my bottom surgery, it's I need to have my bottom surgery. For my mental health, for my stability, for me being me. I don't feel like I'm completely me. And I think this surgery, it's actually two surgeries, the vaginoplasty and the vulvoplasty, I think they're going to help a lot. And so I'm excited about that, but I'm also very nervous about this surgery. It's intense. I check into this surgery the day before. I have the surgery in the morning. I'm gonna be under for 6 to 8 hours, something like that, for this first surgery. And I'm gonna have to be in a recovery room. I can't even get up and leave this recovery room for 9 days. 9 days I have to be in a recovery room. And then I have to recover for 3 months. And then after 3 months of getting blood flow back to this area I've had surgery on, I go back under again. And the surgeon's going to do the second part of it, the vulvoplasty. Okay, well, I'm gonna end this talk. So y'all have a great day. Love yourself and treat people the way they want to be treated.